Kia ora, hello everyone. I'm here today with J.Byles from the University of Newcastle and the Hunter Medical Research Institute. We are so excited and privileged to have you, Julie, as one of our international keynote speakers at this year's NZAG conference in Wellington. So can you tell us a little bit about your background and how you came to do aging-related research?
Oh, wow. Yes, thank you. That's a great question. Look, I'm really excited to be coming to Wellington and to join in with my friends and colleagues in New Zealand. I've had a lot to do with people across the sea, across the channel there for many, many years. So it's exciting to be able to participate in this very honoured role as keynote speaker. I'd like to also acknowledge all the Maori and Indigenous people and also the Awabakal people whose lands I sit on here at the Hunter Medical Research Institute. And I think that's something I've always been impressed with New Zealand, how much you're able to acknowledge and give space to the Maori people in not just your conferences, but every walk of life. It's great. So yes, how did I get into aging research? And it started a long, long time ago, back in probably 1994, when I'd been working rather intensively through my PhD, as many people will relate to, on women's health. So I was looking at encouraging screening for cervical cancer to prevent cervical cancer. And so I sort of come up for air after that and I found myself a job at the Centre for Clinical Epidemiology and Biostatistics teaching epidemiology. And I took on a role to look at how we could prevent poor health and improve quality of life among older people. It was veterans and war widows at the time. And so I worked with the Department of Veterans Affairs in Australia to develop a preventive care program for older people, which involved quite in-depth assessments and then following people through. And we undertook quite a large randomized controlled trial. And that ended up in the health assessment program for over 75s that we have in place today, and which most older Australians would have had at least one of those. But then I had another opportunity, life's about taking the right opportunities, had another opportunity to join in a bid to run a very large longitudinal study of women's health in Australia. And we decided at that stage to not only include young women or middle-aged women going through menopause, but also to add in a cohort of women in their 70s. And I think we naively thought, well, that'll top it off, women in their 70s. And I decided to take on responsibility for that older age group, partly because I read all the comments they wrote on the back of their surveys. There were 12,432 surveys and 7,000 comments, and I read all of them. And the women just captured my imagination and have never lost me, never left me. And so here I am today, and I'm able to tell their stories. Some of them go for longer, some of them are richer. Some of them are happier, some of them are sadder, but I'm able to tell all those stories both quantitatively and qualitatively. And so I think they've helped me learn a lot about aging, a lot about life, a lot about being a citizen.
Oh, wow, that's fascinating. What an exciting opportunity and exciting data that you have. And hopefully you will share some of that with us at
Absolutely.
NZAG.
Yeah.
Clearly, you've done a lot of research in the women's health space. What do you think are some of the main pressing issues for women in today's society as they navigate aging?
Yeah. Well, with our oldest cohort, by the time we started the study, about 35% of those women were widowed, which is sad, and they definitely missed their husbands. But we were able to follow them as they developed a new way of life as single women and single older women. And whilst they found it difficult and did have financial difficulties, they did at least have the advantage of having a whole house. And even if it might have been an older house and needed repairs and they needed some handyman help. But the next cohort of women, they're entering into their older age, often divorced and separated. And that means assets have been divided often. So for them, homelessness or potential homelessness or precarious housing is a risk. And so we do find that that's a problem for our women in their 70s now, who were in their 40s when we started the project. So I think looking at socioeconomic disadvantage, we have a narrative, which I'm sure you have in New Zealand as well, about the older generation being asset rich. And sometimes some intergenerational tensions, certainly with housing prices and the difficulty that younger generations have in even being able to get the money together to get a loan to purchase a home, versus the equity that older people might have in large and now very valuable homes. But I think that headline hides all of the nuance and all of the details. And so I think many older people are struggling financially. Housing is a big issue for many of them, whether they have a house, whether they're able to afford rent, whether their house is adequate to their needs or safe, and whether it creates social isolation for those people. So I think that is a big issue for them. The other big issue is getting access to healthcare, and it seems quite ridiculous that in countries like Australia and New Zealand, older people would have difficulty getting access to healthcare. But for whatever reasons, waiting lists are longer, even to see a primary care physician or a general practitioner. Healthcare is getting more expensive with co-payments, even though we have a universal insurance program through Medicare, and waiting lists for things like cataracts and knee replacement surgeries, which could do a lot to help people keep going, and make that difference between disease and disability and abilities and inabilities as people go through later life.
Absolutely. I think those are two really, really important areas that you mentioned. And also one thing that I picked up from what you were saying, that in a way, older women nowadays are maybe worse off than the previous generation. And we like to think that we are making headways and inequality.
Yeah, look, there's good news and bad news. There's very good news around their if you're talking about healthy aging and their physical abilities. So we find actually that this new generation of women are advantaged compared to the older generation in what they're able to do. And that's really good. And I think I attribute a lot of that to education. That makes a big difference. Also to reductions in smoking, increases in physical activity. But somewhere in there's a little minus sign in relation to the increased levels of obesity and overweight in that group of women now compared to the 70-year-olds 25 years ago. So I think there's big gains. There's a few steps backwards. And then socially, I think it's not disastrous, but I think we have to always be aware that what we see on the top of the surface doesn't tell us what's going on for subgroups of people and disadvantaged groups of people and people with different circumstances. And we always have to be careful not to make policy just based on the headlines.
Absolutely. I think that's a really important message. So you've already given us a little bit of a sneak peek into your presentation. Is there anything else you want to share or tell us a little bit about what you're going to cover in your keynote talk?
Yeah, so I've decided to call my talk Life Course, Lifestyle Outcomes and Outlooks, Lessons from the Australian Longitudinal Study on Women's Health. So really telling that longitudinal story of the women as I followed them from their 70s to now they're over 100. Obviously not all of them have survived that long, but then also looking at the development of disease and disability along that path, looking at their use of healthcare services and their use of aged care services. And then looking also at, some of the really positive stories that come out from some of the women who we interviewed, over 50 women who were aged over 95 years of age. And so there's some really positive stories there, and not just about being perfect, but about adapting and finding happiness, given your circumstances. And I think also I'd like to draw out some illustrations of how longitudinal studies can add value over and above cross-sectional studies or other ways of looking at data, and to draw out the ways that they can be used in policy and planning.
Absolutely. I think that's so important, and I'm sure a lot of our audiences will be excited about those really important messages. Other than giving your exciting keynote talk, why are you looking forward to attending NZAG? What are you hoping to get out of it?
Oh, well, I'm looking forward to meeting up with old friends. I'm looking forward to understanding a bit more about what's going on in New Zealand and catching up with what's happening over there. And I'm also going to take myself off for a little bit of a exploration of the Marlborough Sounds region. So I'm really looking forward to that. I think I might go on the mail boat run and deliver the mail to some of the people living along the coasts there.
That sounds wonderful. I'm so glad that you get to experience a little bit of this beautiful country and have a holiday, not just work. So that's fantastic. We are so looking forward to having you here. And thank you again for coming to the conference.
Oh, no, I'm really, really honored to be invited. Thank you very much.
Well, see you in a few weeks.
Okay, see you soon. Bye.
Bye.